Hey mamas and daddies, today I am going to share answer of questions which comes in your mind if your pregnancy is high risk pregnancy. Warning signs of preterm labor, causes of preterm birth, who is at risk of preterm birth and how to prevent preterm birth. What is preterm labor? Preterm labor occurs when regular contraction starts and start dilating cervix, start opening cervix after 20th week and before 37th week of pregnancy. But why I am sharing all this information? Because I am a mother of 24 weeks micropreemie and I have been through preterm labor and preterm birth. I have studied, researched and gained knowledge about preterm birth from reliable sources. What are symptoms of preterm labor? Regular and frequent sensation of abdominal tightening, constant low dull backache, sensation of lower abdominal pressure, abdominal cramps like menstruation cramps, vaginal spotting, it can be pink, brown or red. Preterm rupture of membranes, it is when water breaks before 37th week of pregnancy. Change in vaginal discharge, watery, mucus or bloody discharge or more vaginal discharge than usual. Pressure in lower belly like baby is pushing down. When to see doctors? If you see any of these signs or symptoms, approach to your doctor right away. Don't worry about mistaking it is false labor or it is real labor. Everyone will be happy if it is false alarm. If you want to know my mistakes which led to preterm birth, link is in the description. This video can be really useful for you because I have shared my personal experience, how I have been through preterm labor and preterm birth, and I have talked with other mothers of preterm babies and share their experience too. After this video, please go through that video as well. Who is at risk of preterm birth? Preterm birth history. If you already have been through preterm birth, you are at higher risk of preterm birth. But good thing about it, you are already aware that you are at higher risk of preterm birth. So you can take precaution from the beginning of next pregnancy. My first baby is extremely premature baby, born at just 24 weeks of pregnancy. And even then my second pregnancy reached to full term. If you want to know how my second pregnancy reached to full term, link is in the description. Multiple pregnancies. If you are pregnant with twins or triplets or you have conceived through IVF and your pregnancy is multiple pregnancy, you are at higher risk of preterm birth. If you haven't subscribed this channel yet, please subscribe my channel and help me to grow my channel. Short cervix. If your cervix is short, there is a risk of cervix opening or cervix dilating before 37th week of pregnancy, which can lead to preterm birth. Problem with uterus and placenta. Placenta abruption means when placenta separates from inner walls of uterus before birth, it can cause heavy bleeding and early delivery is needed to save your life. Smoking, tobacco, alcohol and illegal drugs can cause preterm labor. Your each hit on like button means a lot for me. Please hit the like button. Infection, particularly of amniotic fluid and lower genital tract. Some chronic conditions such as high blood pressure, diabetes, autoimmune disease and depression. Mamas and daddies, emotional health is as important as physical health, and in my opinion, emotional health is more important than physical health. Please take care of your emotional health too. Stressful life events such as death of loved one, too much amniotic fluid, vaginal spotting or bleeding during pregnancy. Presence of fetal defect, gap in pregnancies, less than 6-month gap and more than 59th month gap in between two pregnancies. Age of mother, if mother is less than 20 years or more than 35 years, then mother is at higher risk of preterm labor. According to WHO, World Health Organization, more than 60% preterm birth occurs in Africa and South Asia, but premature birth is truly a global problem. How to prevent preterm birth? There are many things you can do to promote healthy full-term pregnancy. Eat healthy. Healthy pregnancies outcome are generally associated with healthy diet. Eat balanced diet with food containing iron and folic acid. Reduce your stress level by yoga, meditation, and do what you love to do. and talk to your doctor if you find anything unusual in your pregnancy. Certain conditions such as high blood pressure, diabetes, and obesity increase the risk of preterm birth. Work with your doctor to keep any chronic condition under control. Gap in 2 pregnancies. If in your pregnancy gap is less than 6 months or more than 59 months, you are at higher risk of preterm birth. Talk to your doctor about pregnancy gap or pregnancy spacing. Avoid smoking, alcohol, and tobacco. Preterm birth can affect any pregnancy and the specific cause of preterm labor is not clear. Mamas and daddies, I have a micro preemie channel in Hindi as well. Link is in the description. Please subscribe my channel and help me to reach to the broader audience. See you very soon with next very informative video. Lot of love to parents and their babies.